The NFL is on concussion watch more than ever this season, with allegations the league denied scientific research for decades that showed a link between playing football and brain damage. Two new studies show children are showing up in emergency rooms in record numbers. We checked with Children's Hospital of the King's Daughters. They saw 378 kids with concussions in the last year. That's up nearly 100 from the year before. Then on your side, Stephanie Harris looked into where we might be falling, or failing, I should say, in protecting our children. Stephanie?
Tom, for starters, doctors say education. Take this helmet, or any helmet for that matter. None of them can prevent a concussion. In fact, you can get hit anywhere on your body and get a brain injury. It's from the shaking. Then there's Virginia law. It only protects a limited number of children. Why? We asked the senator who wrote it.
The hits are almost always hard, but the injuries aren't always obvious.
My eyes are trained to look for that. I didn't visually see it.
Old Dominion University football coach and dad, Bobby Wilder, is talking about the concussion his son suffered during a football game. It wasn't until 2 nights later, when Derek started having trouble concentrating, that his parents and coaches pulled him from play.
Even though we think this is his first concussion he's had, we're trained for the symptoms, so we knew exactly what to see.
But not every parent or even every coach is trained, and it's not just football players getting hurt.
Last year I saw more cheerleaders than I did football players.
Dr. Joel Brenner is medical director of CHKD's sports medicine program. He sees about 20 new concussion cases a week.
Basically your brain kind of shakes back and forth, and then it causes a disruption within the brain.
The longer it goes untreated and the more often it happens, the worse the risk.
We do know from research so far that people with 3 or more concussions actually have a higher risk of memory problems long term.
And it's rare, but athletes under 21 are also at risk for something called second impact syndrome. That's when a young athlete gets a second brain injury before the first one is healed. It can cause permanent brain damage or even death. That's why Virginia law requires schools to pull any athlete suspected of having a brain injury. They must be evaluated by a licensed healthcare provider and cannot return without written clearance. That law has helped educate parents and coaches and help protect thousands of athletes who play school sports. But thousands more play organized and recreational sports outside of school. I sat down with Senator and pediatric neurologist Dr. Ralph Northam, who wrote the original law 2 years ago.
Regulating public schools. Is that enough, though? We've got so many children, so many more children that are playing in rec league right now. Should we expand the law?
Oh, absolutely. We really need to reach out to those that are in the rec leagues, and especially the rec leagues that use public school facilities.
But that legislation can only go so far. Say a child plays football and baseball. Privacy laws prevent coaches from sharing players' medical information. So ultimately, it's up to individual parents and coaches, like Bobby Wilder, to tackle the issue with young athletes.
I care less about what happens to you on the football field than I do what happens the rest of your life.
And if you're not sure about the symptoms yourself of a concussion or where to go for help, we've made it easy for you. We put links online to an impact test, local sports medicine clinics, and much more. Just go to wavy.com and click on this story. Stephanie Harris, 10 on your side.